1 in 9 Indians is vulnerable to cancer, but early detection can save lives. Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.
Hello and welcome to this special presentation of Sanjeevani, United Against Cancer, a mass awareness campaign that aims to promote the early detection of cancer. I'm Ekta Batra. Today we are focusing upon cervical cancer. This type of cancer develops in a woman's cervix, which is the entrance to the uterus from the vagina. It is reported that cervical cancer claims the life of one woman every 7 minutes in the country. But this is also a type of cancer which is largely preventable through vaccination and routine screening. To discuss the importance of prevention and early detection of cervical cancer along with the current and future treatment options for patients, let me invite our esteemed panelists. Dr. Boman Dabar, Director Oncology, Fortis Mulund, Dr. Joshi, Principal Director, Gyna Oncology, Fortis Gurgaon, and cancer survivor Priya Parab. Doctors as well as Priya, welcome to the show. Well, Dr. Joshi, let's start by talking about understanding what exactly cervical cancer is and what is the burden that India faces.
When we are looking at the burden of cervical cancer in India, looking at the global burden, almost more than 6 lakh women are diagnosed of cervical cancer globally. And India contributes to around, say, 21% of it total. Around 1,23,000 women are diagnosed of cervical cancer every year. And out of this, actually, we have the mortality rate, which is very high, that is 77,000 women die of cervical cancer, a cancer which is a preventable cancer. So this is what is the cervical cancer burden, so far as our country is concerned.
Why does India have such a high burden?
We do not have the proper cervical screening program within the country. Screening is still opportunistic. We do not have any national immunization program actually addressing the cervical cancer vaccine. It has not been included in the national immunization program. So these are the facts by which the advantage of the cervical cancer prevention by vaccine as well as the screening does not actually reach to the grassroots population. That is the reason that we are still lacking on the control of the cervical cancer as such.
Okay, well, Dr. Dabar, wanted to get your thoughts in. When we talk about cervical cancer amongst women's cancers, where exactly does it stand?
Incidence point of view, it's the second commonest cancer, including mortality from all the female cancers that we know of. Breast leading the way as far as the incidence is concerned. Next is cervical cancer. And again, it depends on the geographic distribution also. If you see from rural areas, it's cervical cancer, which is the commonest. And if you see in the urban areas, it's the breast, which is more common. Now, as ma'am has said, screening is so important that this should be drained or drilled into the mind of young ladies, that please take part in screening programs. And this should be an educational thing that every individual should be absolutely pro for a screening program.
Dr. Dabar, just wanted to understand, what are the key risk factors when it does in fact come to cervical cancer?
See, what we know about cervical cancer is the cause right now. Most of the cervical cancer are because of an infection called a human papilloma virus. So there are HPV related causes and there are something what we call as non-HPV related causes. In HPV related causes, it's like multiple pregnancies, multiple sexual exposures. The age of onset of the first pregnancy below the age of 20 is itself a high risk factor. Socioeconomic status comes in non-HPV related. Why? Because if your socioeconomic status is not so good, you don't take part in cervical cancer screening, you are so tied up in other things, and all those are other causes. If the male partner is HPV infected, he will distribute it to many people also. So multiple sexual exposures itself.
Dr. Joshi, in your opinion, what is the treatment choice if in case somebody does have early stage cervical cancer?
In early stage cervical cancer, surgery is the treatment of choice. We can preserve the ovarian function, the ovaries can be preserved, as well as the vaginal function is far better. And it is very much curable by surgery in the earlier stages, where the survival rates that goes to even 95 to 97%.
Okay. And what would be the key symptoms?
In very early stage of the cervical cancer or in its precancerous condition, it doesn't have any symptom. And the symptoms come when the disease develops in the region of the cervix. And at that time, the patient usually feels, some symptoms or the signs that there can be intermenstrual bleeding if suppose the patient is in the reproductive age group, or there can be bleeding after the intercourse, or just spotting after the intercourse, or there can be bleeding after the woman achieves menopause. There can be some kind of the blood-stained discharge. So these are some signs. Patient usually doesn't have any pain as a symptom for the cervical cancer in its early stages. Pain usually comes as a symptom when the disease is advanced.
Now, before we come to screening, I just wanted a few more details about HPV. Is that the main reason for all cervical cancer cases?
Most of them, I would say, are HPV related. There are different genomic mutations within this HPV. What we call as 16 and 18 are the most commonest types. If you are infected with, most of us are infected with, but you should be able to clear this virus off. If you can't clear this virus off, then you are staying with the virus, then it becomes a part and slowly malignancy sets in.
Priya, thank you very much for taking the time and coming to our studios and talking to us about something which is so critical and important. If you could just start by just giving us a sense in terms of your journey and where you are today.
The symptoms were not obvious at all till a very late stage. I started feeling a pain in the right hip, which lasted a few seconds and it passed away. And it was ignored and I carried on with my usual routine. Again, after a few months, I got that pain and it subsided within a few seconds and I just took it in my stride. And the third time it came, it lasted for a good 20 minutes. That is when I got alerted and I said, is it a kidney stone or is it appendicitis or why that pain? So I decided to go for a sonography and then my family said, better go for a complete health checkup. It's anyway due. So then that is when it was discovered that I have this cancer and it's already stage 3C.
And how long has it been?
2016, I was detected first time. Now mine was a recurring type, unfortunately, so it has come back again and again. This is the fourth time I have gone through chemo. So,
but it's
4 times it has. I have come out of it, cured, led a normal life, and it has come back again.
2024, so it's been many years since you've actually even managed the cancer and managed to live your life. I think that's the key takeaway from this conversation as well, that one shouldn't also be scared. While we do talk about screening and prevention, one shouldn't be fearing the fact that they could probably even be diagnosed with cancer. Doctor, tell us more about, the key message about treatment of cancer and managing cancer with, say, active surveillance and treatment.
Treatment over the 30 years, what I have seen has transformed from, simple things like supportive measures, like nausea, vomiting, which we used to have with chemo. Totally we can take care most of the time. Nausea may remain, but now we can got so many good supportive measures. The main treatment has also transformed from simple chemotherapy drugs to now we have got targeted therapies, we have got immunotherapies, and there's supportive care, and now we have got so many associations also for the patient, where they take part and they can interact with those people who have gone through it. And there are newer treatments like targeted therapy and immunotherapy in some cancers, obviously. They have made the cancer like any chronic disease. And you take those tablets and it goes on. So we have got targeted therapies now, immunotherapy which has come. 20-30% patients on immunotherapy, even if they're in an advanced stage, of course for the right cancer, the right treatment is required, they stay for a very prolonged period of time with a very good quality of life. So things have evolved a lot. So not to think that, nowadays that cancer means there's nothing we can offer.
So tell us, what should be done in terms of early screening? What age does it start? Which are the tests that one needs to take?
I would like to point out that every woman who is feeling healthy must go for the screening test. And these screening tests vary from, based on our protocols. We can go for the pap test or simple pap test. That is where we actually just take the cells from the surface of the cervix just by wiping it out and spread it on the slide and look into it whether the cells are showing any kind of the precancerous actually change or not. So we can detect it by the pap test, and we can combine this test with that of the HPV DNA testing, because HPV is the cause. So we can know whether these are HPV positive or these are HPV negative. So this is also included in the screening test as the screening test. But the limitation is in the rural areas where the women do not have actually such facilities where they can really go for these tests. There are no infrastructures. There is lack of the resources in the rural areas. So there the screening method is very different, where the paramedical healthcare workers, these have been trained in order to pick up any kind of abnormality just by using the visual inspection with that of simple acetic acid application. So they can even pick up those abnormalities on those cervix, and these patients can then be transferred, or rather can be taken to the place where there is facility for further diagnosis as well as the treatment of the cervical cancer.
Okay, well, on that note, it's time now to slip into a short break. On the other side, we'll go deeper into the management of cervical cancer. Keep watching Sanjeevani, United Against Cancer.
1 in 9 Indians is vulnerable to cancer, but early detection can save lives. Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.
Welcome back to this special episode of Sanjeevani, United Against Cancer, where we are discussing one of the top cancers affecting women globally and in India, cervical cancer. Well, before we took a break, Dr. Joshi, we were discussing early screening. If you can just give us a sense of what stage or what age do you recommend someone to start screening themselves, start doing that regular pap smear, start doing that regular blood test to assess HPV, and what should probably be the key highlights or red flags one should keep in mind?
Screening should be started, rather it is recommended by the FOXI in India to start the screening by the age of 25 years. But in the rural areas, we can start the screening by 30 years of the age, because we actually to utilize the resources and all to the best. If suppose we are using the combined screening test or the co-testing of the pap test and HPV DNA testing, then the screening requires to be done just after 5 years. And the repeat screening can be done every 3 years when we are not using the co-test and we are using only the pap test. And in the rural areas, when VIA or visual inspection with acetic acid is being used, we start at 30 years of the age, and every 5 years we can really screen these women. So this can reduce the incidence of the cervical cancer and also the cancer death. And it has been seen and very well documented that it reduces the cervical cancer death by 95%.
What about the vaccination? What age do you recommend one can be eligible for the vaccination?
It is recommended for the age of about, say, 9 years to 14 years of the girl. When she gets the immunization with that of the HPV vaccine, then definitely the immunity is much better. But it can be given to the women of up to 26 years of the age. After 26 years of the age, if any patient or any woman wants to get the vaccine, then that should always be under supervision, because it is very important to tell the woman over the age of 26 years that the effectivity of the vaccine will be comparatively much less in comparison to those women who are receiving the vaccine by the age of 26 years.
All right, Dr. Bowman, we were discussing treatment options and the fact that, there are many treatment options available and not just surgery. Can you list out what would probably be the most effective options which are available for early as well as late stage treatment of cervical cancer?
For local forms of diseases, it's a local treatment. That is either surgery or radiation. Locally advanced is usually we give chemotherapy and radiation both together. And for advanced metastatic disease, things again have evolved there a lot. We don't want any lady to be under locally advanced or metastatic disease. So the importance of cervical cancer screening is here. If any lady unfortunately develops an advanced disease, it's lack of screening from our part. But for a metastatic or an advanced disease, it's usually what we call as systemic therapies. And systemic therapies, we have chemotherapy, we have got targeted therapies, means what we call as anti-angiogenic treatment. Those are also intravenous, and we have immunotherapy now. So with this, even in a metastatic disease, we have seen survival going into long durations.
Okay. Well, Dr. Joshi, in your experience, what would be the best treatment options when it comes to early stage cervical cancer and also maybe even protecting a woman's fertility?
The majority of the women who are undergoing the screening, they are picked up and diagnosed in early stage where the cancer is totally curable. And that's how the surgery plays a very, very important role. Here, because of the screening and all, we are getting, more and more younger women coming to us in the younger age group. They are in their late 20s or 30s. I think we have treated such patients where they come with the diagnosis of the early cervical cancer, and we have opted for the fertility preserving surgery for these patients. We preserve the uterus, and later on this patient can conceive. And the results so far as oncological outcomes are concerned are very similar to that of the radical hysterectomy. So we are focusing on to quality of life of these patients by modifying the surgical treatment.
All right, Priya, just a quick question. You battled cancer for so many years now, successfully, may I say. How important is the support system?
Oh, I would say it is a parallel lifeline for the patient. By example, like as a patient, what is the kind of support system I was surrounded with? My father makes fresh ABC juice every morning for me. Okay, my husband is taking care of the bills and the insurance claims, and he or my son are driving me around for the frequent hospital visits, blood tests, and various other things. And besides all this, the emotional aspect. See, I would have mood swings. I would be irritable. At one point, I would say that one more time I have to go through this and I'm going to kill myself. I mean, I would be at that verge of frustration. And in those times, it's like, you're in a race, you're on the ground, but your hands and legs are broken. And through sheer grit of the mind, the strength of the mind, you have to reach the finishing line. That is the state in which the patient is. Support system has to be just rallying around you. There are so many things to be done and so many people. I mean, the hands are just less.
Well, on that positive note, Dr. Bowman, I'm just going to get the last word from you. There is a target by the WHO that we could probably eradicate cervical cancer as well, because of vaccination and early screening, something that you've emphasized. If you could just give us the top 3 points on your mind in terms of how we Indians need to tackle the cervical cancer burden and disease.
The screening procedure itself is a painless procedure. So it's not like a grilled MRI or a CT scan that you go through. So they are most of the time absolutely painless procedures, but just you should be volunteer yourself. That is from our side, medical side. From the government or this other sides, it is the educating the people and at the same time making it available for them. The center should be there for screening. Vaccination is also very, very important, and the most recommended vaccination is what we call the quadrivalent vaccination. The cost and all those things should be also bearable to our people, the rural areas. We are not talking about the urban areas. It should be all, and it should be also an education that it is so important to do that. You can save lives, and I would tell you, no person would die of cervical cancer if you do that thoroughly.
Okay, and lastly, cancer is not a scary word.
Absolutely.
At least
today. It is just like what you say, any other chronic disease.
Yeah.
We can make it into chronic disease, some of the cancers, I would say, even in an advanced stage. Although we don't want any of our patients to go into the advanced stage.
WHO actually launched the cervical cancer elimination program in 2020. And basically looking at the 3 pillars. One is the HPV vaccination of 90% of the girls below the age of 15 years. And 70% women should be screened at the age of 35 and 45 years. And also 90% of the women should be treated adequately once they are diagnosed of the cervical cancer. This was the global, actually, the challenge. How to reduce and to eliminate cervical cancer globally. It has also been seen that in Punjab as well as in Sikkim, these are the 2 states which have immunized almost 95% of the girls under the age of 15. India will be able to eliminate cervical cancer, it is predicted, by the year 2065. And by the year 2035, the mortality can be reduced by 50%. So I think the country is also looking into very seriously in order to control and eliminate cervical cancer program.
Okay, all right. It's been a pleasure, Dr. Joshi. Dr. Dabar, thank you very much for joining in, as well as Priya. Before we end the conversation, your last thoughts, Priya.
Yeah, so it could be any type of cancer and any disease for that matter that comes to you is not in your hands. But the recovery, the healing is definitely in your hands. So instead of brooding and looking at the ceiling, take control of the situation and work towards healing yourself, and everything will be fine.
Priya, Dr. Joshi, Dr. Dabar, thank you very much for taking the time out and sharing your experiences, your thoughts and your knowledge on cervical cancer. Thank you very much. With that, we have come to an end of this special presentation of Sanjeevani United Against Cancer. Thank you, doctors, for your insights on the subject of preventing and managing cervical cancer. I would urge everyone to join hands with us on Sanjeevani United Against Cancer. Yaad rakhe, screen kare.
1 in 9 Indians is vulnerable to cancer, but early detection can save lives. Federal Bank and News 18 Network present Sanjeevani United Against Cancer. Knowledge partner Tata Trusts. Yaad rakhe, screen kare.